there it is. There's my house. Oh, boy. Am I glad to be home. Golly, am I ever glad to be home.
Dad, where are you going?
I'm going home.
Dad, you are home.
Home? No, I'm
You're
going
home now. You're home with me.
I'm home?
Do you want to go to your bedroom?
Who's bed?
Can I do anything to help, sweetheart?
You can dry the dishes.
Great. Mary, whose birthday cake is this?
Don't you remember? It's yours. We just had your party.
Mine?
Yes. How old are you?
I'm 52.
Oh, no, darling. You're 65.
Who? What? Why? No. Go away. No. What do you want? Get away from me. Oh.
Dad.
Leave.
Dad.
Get out of here. No.
Dad,
no,
give
no.
me the knife.
What? No. No.
There's nobody there.
But I need. They're.
Dad, there's nobody there.
They're after me.
Give me the knife. Give me the knife, Dad. Nobody's there. It's okay. You're fine. You're home. No, it's okay.
It's all right.
It's all right.
It's all right.
It's all right.
Okay.
Come on, let's go.
All right.
There's nobody there.
All right.
You have seen some of the signs and symptoms of Alzheimer's disease. The problem is that the brain is injured. It's similar to an electrical cord that has a short. Sometimes the current gets through, sometimes it doesn't. Hi, I'm Dr. Darel Butler, a specialist in Alzheimer's disease. For too long, the words Alzheimer's disease have struck terror in the hearts of the afflicted, their caregivers, and physicians alike because there was nothing one could do. Now we have ways to fight this illness, and I'm going to show you how to fight it. If you have Alzheimer's disease or are caring for someone with the illness, these programs will help you better understand the illness and manage difficulties at home. This means fewer doctor and hospital visits, less stress, and less expense. If you are a healthcare provider, you will learn techniques to manage the more difficult aspects of the illness, and this you can share with your patients and their families. That means fewer phone calls and emergency visits, better managed patients, and more families who are happy with the health care you provide.
Dr. Darel Butler trained at Harvard University and the University of California, San Francisco. He has years of experience with this illness and sees hundreds of patients each year. He worked in a laboratory where a Nobel Prize was given for work related to Alzheimer's disease. Perhaps most importantly, he has firsthand experience with several family members who have the illness. This personal experience taught him how to cope. He truly knows what you're going through and is here to give you help when you need it.
We sure are going to have a great time this evening.
Oh yeah, I'm anxious to get there and see everybody.
Miss Linda's 50th birthday.
Where are we going?
Miss Linda's birthday party.
Miss Linda's, okay.
Yes, ma'am.
What time are we going?
We're going to go at about 3:50 because it starts at 4.
Okay.
All right.
So what time is it now?
It's 3 o'clock. You're going to be so pretty.
Will the twins be there?
Yes, ma'am. I do believe they will be. They wouldn't miss it for the world.
Okay. What time is good?
Mom, it's 3 o'clock. You just asked me that it's 3 o'clock, Mom.
I just asked you.
You sure did.
Mary, have you seen my car keys?
No. Where did you leave them?
I don't know. You sure you haven't seen them?
No, I haven't seen them. Are you sure they're not on the dresser?
No, I'm not sure of anything. this place? I've been here a million times. Now, this is Auburndale. Just doesn't ring a bell. This is incredible. Just gonna have to ask something. Excuse me, please. I seem to have gotten myself turned around. There's an auto parts store around here somewhere. I've been there a million times and I just can't seem to find it. Can you help me out?
Oh, the auto parts store is right here on the corner. You just passed it.
On the corner?
On the corner.
Okay, great. Thanks. I'm really kind of embarrassed. Understand this. I played this thing a million times. Get up.
I just can't do it.
Helen, have you been to the bathroom this morning?
Yes.
Let's try one more time, okay? Oh, thank you, Helen. Here we go. Watch your step.
In this program, we will discuss the signs and symptoms of Alzheimer's disease. This will lead to an earlier diagnosis and better management of the illness. Remember this, there will be fluctuations in the illness. At times, the symptoms will be absent and the affected person will act normally. At other times, the symptoms will be present, and you may get the impression that the affected person is being stubborn or otherwise trying to deceive you. You must remember that the brain is injured, but not destroyed. It's for this reason that the symptoms fluctuate. It is also important to remember that the battle against Alzheimer's disease is a spiritual battle as well as a medical battle. The spiritual battle is against frustration. You will get frustrated at times, but the important thing is to let those times be infrequent and short. In this way, you and your family can win the battle against Alzheimer's disease.
Memory loss is the most common symptom and is usually the first symptom. This may be noticed in several ways. One way is losing or misplacing objects. Things that were once routine.
What's wrong with this thing? Why can't I figure this out? I give up.
I'm going to try to get this cake together before I have to go to the movies. I was going to the movies this evening, but oh, I haven't done my flour yet. I put 2 eggs in it. Oh my goodness, I don't know, Carol. I don't know if I can even finish this cake.
You sure you got it?
Repeating things over and over, or having to have things repeated over and over, is another symptom.
Oh yeah, I'm anxious to get there and see everybody.
Miss Linda's 50th birthday.
Where are we going? Where are we going?
To Miss Linda's birthday party.
Miss Linda's birthday.
Do you see that woman? Do you see her? She is here all the time. She's here all the time, and I know why. She steals. She steals my clothes. Look at her.
Paranoia is common. The affected person might not be able to find an object and then accuse others of stealing it. The affected person may have difficulty with thinking of the right words to say or pronouncing the words themselves.
Oh, do you? Where you going?
I gotta go to I gotta go to, you know where.
The manicurist?
No, the manicurist is there, but I have to go to the, where I get, who does
Hairdresser.
The hairdresser.
Okay.
Yeah, to the hairdresser, to the beautician.
Okay.
There may be confabulation, meaning that the patients make up things that are not really true.
Show. The show I put on under the big top. One of the best. One of the best.
Show? What do you mean show?
At the circus, the show with the big cats. I mean, they were never better. Those lions and tigers, they did everything I asked them to do. Most applause I've ever had. Best show ever. Yeah.
You were here last night with me, Dad.
But after the show, let me tell you, they did everything. They climbed up on the stools, they went through the hoops, and then for the grand finale, I lit the hoops. The ring of fire, one after another. Lions and tigers went right through. Great, great. It was the best. It was the best, Michael.
Disorientation and confusion are common. The affected may get lost in familiar places, such as their own neighborhood or grocery store. They may get lost while driving to a familiar place.
Dad, where are you going?
I'm going home.
Dad, you are home.
The affected person may begin to wander and want to leave the home.
Do you want to go to your bedroom?
Whose bedroom?
Your bedroom. Let's go down that stairs, right?
This confusion may become more difficult at night and is sometimes called sundowning. Seeing things or hearing things that are not present can be disturbing. One might tend to live in the past, talking often to and about people who are dead, or talking about things that happened a long time ago. Other symptoms may occur later in the illness, such as incontinence or losing control of the bladder or bowel.
It's okay, Dad. I'll help.
No, you just go back now.
People who were once passive and docile may become irritable and violent.
Oh, yeah. Oh, sure.
Please, that incessant talking, Mary, please.
Yes, yes. Well, maybe next time I'll be. Oh, yeah. Yeah. Oh, sure.
Mary, please get off the phone now.
Ed, just a minute.
Good morning, Helen.
Good morning.
Severely affected people may become completely dependent for all their needs, including feeding, bathing, and dressing. Some people may even become bedridden.
Remember to lower your chin. You swallow.
Now you've seen some of the major signs and symptoms of Alzheimer's disease. Not everyone experiences each symptom. If you're suspicious that you or a loved one may be affected, go to see a doctor. If the diagnosis has been made, see the remaining programs in this series. Get the help when you need it.
Who? What? Why? No. No. Go away. No. What do you want? Get away from me. Oh.
Dad.
Leave.
Dad.
Get out of here. No.
Dad,
no,
give
no.
me the knife.
What? No. No.
There's nobody there.
But I need. They're there.
Dad, there's nobody there.
They're after me.
Give me the knife. Give me the knife, Dad. Nobody's there. It's okay. You're fine. You're home. No, it's okay.
It's all right.
It's all right.
It's all right.
It's all right.
Okay.
Come on.
Hallucinations come in many forms. Sometimes they may be threatening.
What are you doing, Helen?
Trent.
What are you looking at?
I'm petting the cows.
You see cows? No, I don't see any cows, Helen.
You don't see the cow?
No.
See the calf? See the calf? Look at the calf.
No, I don't.
At other times, they may be harmless.
You still see the cows?
No.
No? Well, good. Good, I'm glad. You feeling all right? Good, you look so pretty today.
But the question persists, what are you supposed to do? As always, safety of the patient and you come first. If the hallucinations are threatening, you need to make sure that no weapons are available to the patient so that he doesn't harm himself or others. If the hallucinations are not threatening, allowing the person to experience them may be okay, especially if it puts them in a place that was once comfortable to them, such as a childhood memory or a reunion with a deceased spouse.
Baby, I sure do miss you.
Mama, what are you doing?
I'm dancing with your dad.
What's the best way to handle hallucinations? Choose the method that is least upsetting. If the affected person insists that the hallucinations exist, despite your pleading, then let them exist, particularly if they're not threatening.
Sometimes you may not know that the patient is having hallucinations because they may occur when no one else is around. The patient may be aware of them and hide it because of embarrassment or even fear to relive it. If there is a change in behavior, particularly if the patient seems more withdrawn or fearful, you might ask them if they see or hear things that other people don't. This may give them a chance to discuss something that is bothering them. Medicines may be necessary, especially if the hallucinations are threatening. Remember, talk to your doctor before using any medicine. Some medicines that help in the short term are Haldol, Ativan, or sedatives such as Benadryl and Trazodone. For the long term, Aricept and Exelon may have a calming effect. Others to be tried are Depakote, Zyprexa, and Risperdal.
Don't let hallucinations frustrate you. You and your loved ones can manage them at home. Get your doctor to help with medicines if necessary.
Didn't we have a nice time tonight?
We really did. You know, I just wish Susan had been there.
Oh, Susan was there.
Susan was there?
Yes, darling.
Are you sure?
Yes, Susan was there.
I guess I didn't see her.
Oh. Well, maybe next time.
Okay.
Good night.
Good night. Oh, my poor Ed.
What exactly is Alzheimer's disease, and how does one make the diagnosis? Alzheimer's disease happens when brain cells in the front lower part of the brain die. In addition to cell death, abnormal proteins get twisted in the brain. They then clump together and form amyloid plaques, or neurofibrillary tangles.
Turn your head toward the wall there.
In a person who is alive, there is no way to know for sure if these changes are occurring. One can only tell at autopsy, because one needs a microscope to see the changes. No blood test, CAT scan, MRI scan, or other test can make the diagnosis. So how is the diagnosis made?
Here, Dad. Let me help you with that, okay?
I just can't.
It'll be fine. We'll get it.
I just couldn't get it.
First, are the symptoms present? If so, then the next question is, are they getting worse with time?
It's gonna be fine.
Lots of illnesses can cause problems with thinking, but Alzheimer's disease is a progressive illness. The problem should get worse with time. Compare this to a stroke, which can cause a big problem with thinking. But once the stroke happens, the problem typically stays where it is or improves. Illnesses such as stroke, alcoholism and other drugs, medications, infections, depression, and brain tumors can cause problems thinking.
Doctor, we're concerned about Ed's thinking. He's been having some memory problems, and he's been having trouble with his piano playing, which he's never had before.
Doctor, look, it's like I'm having trouble performing routine tasks, things that I've always done.
Can you give me an example?
Well, Mary mentioned the piano playing. Pieces that I've played for years by heart, I can't remember. And the other day, I couldn't get the hood up on my car. I couldn't remember where the latch was. A week or so ago, I was going to go out to the auto parts store. I couldn't remember where it was.
I can see that these problems have been concerning you, and I think that it's good that you came to see me. When problems with thinking arise, it's important that you be evaluated by your doctor, perhaps even a neurologist or someone who has a special interest in problems thinking is most appropriate. There's some tests that we're going to do. Okay, we're going to see if there's any illness that we need to be concerned about, and so we're going to go through those tests now. We will begin with a physical examination to look for signs of other illnesses. We will give you tests of your thinking, including a mini mental status examination. There are some blood tests that we do as part of the evaluation. In addition to the standard blood cell count and chemistries, there's a test that's called an RPR, because sometimes an infection involving neurosyphilis can cause problems thinking. There's a test where we look at vitamin B12 and another vitamin called folic acid, because vitamin deficiencies may cause problems thinking. And finally, one of the more standard tests is a test to look at how your thyroid's working. And that's called a TSH. So my nurse here is going to help draw that blood, and then after that, we'll proceed through the rest of the evaluation. We will take a picture of your brain to help decide if strokes or even a brain tumor are present. So now we can go and review your other test results.
Great.
Okay? Depending on these results, we may need to do a spinal tap or lumbar puncture. Now, let me explain to you what this procedure is about. There's a fluid that surrounds your brain and your spinal cord, and it nourishes them, okay? That fluid is called cerebrospinal fluid. Sometimes it may get infected, and if it gets infected, it may affect your thinking. The only way to analyze that fluid is by a spinal tap, and that's what we're going to go through now. I first clean off your skin. I take a small needle like diabetics use to give themselves insulin, and I numb up this area beneath where your spinal cord ends. Okay. After numbing the area, I take a longer needle to actually insert into the space where the fluid is. We take off some of the fluid, and then we send it down to the laboratory for analysis. And that can tell us whether or not there's any infection we need to be concerned about. Another test that we do for this evaluation is an EEG, an electroencephalogram. Our brains work by electricity just like our hearts do. So you know how one puts the electrodes on your chest to measure what your heart does? Right. We put these on your scalp to measure what your brain does. Okay, we're going to put them in different spots all the way around your scalp. Okay? And there's going to be some glue that's going to be used to make sure the electrodes stay attached. And we're just measuring the electrical activity. Once all the tests are done, and if they all come back normal, there's an 85% chance that you may have Alzheimer's disease. Okay, so what does that mean? It means that if one were to look at portions of your brain under a microscope, there'd be an 85% chance that we'd find those abnormal proteins we discussed earlier. We'd find the amyloid plaques and the neurofibrillary tangles in the right places and in the right amounts typical for Alzheimer's disease. Once the diagnosis has been made, a treatment plan must be made. Treatment is available now that wasn't previously available. We don't want to deprive anyone of the opportunity to be treated. See the treatment section in this series.
Oh, there it is. There's my house. Oh, boy. Am I glad to be home. Golly, am I ever glad to be home.
Dad, where are you going?
I'm going home.
Dad, you are home.
No, I'm going home.
You're home, Dad. Do you want to go to your bedroom?
Whose bedroom?
Your bedroom. Your bedroom's right down this way.
Oh, my bedroom?
Yeah.
Oh, okay.
Let's go, okay?
Okay.
get out of this door.
Tell me, what do you need to get out the door for?
Who are you? Get away from
What do you
me.
need? What do you need to get out the door
I need
for?
to go home.
Tell me, what do you need to go home for?
I need
What
to
do you?
go
Tell me what you need to go home for.
I need to water my plants.
Oh, you know what, Layla? There's some plants of yours down here.
No.
Tell me what kind of plants you have at home.
Not of mine.
Tell me
Mine
what
are
kind
at
of
home.
plants you have at home.
At home,
Uh-huh.
I have 4 o'clocks.
You
and
do?
I have
You know what?
those ornamental cabbages.
There are
you know.
some of
And-
your 4 o'clocks and marigolds, and your cabbages are down here. Would you help me go water them down here?
Oh,
Down this way. And if they're gonna die if we don't water
do
them.
you have
So
a can?
I do.
Wandering and an intense desire to go home are 2 common symptoms of Alzheimer's disease. Here's how to handle this.
The first thing to do is find out if the person is sick, especially if this is the first time they have acted this way. Look to see if the person is sweating, flushed, or otherwise looking ill. Infections in the blood, urine, or lungs can cause people to behave like this. Heart attacks, medications, alcohol, or other drugs can cause this behavior. Check to see that they have not taken the wrong medicine, an overdose of medicine, or something else. Are they safe? If they were to get out, especially without your knowing it, could he or she be found?
Louis, hi. You look lost. Come on with me. I'll put you in my car and take you back home.
Thank you.
Okay. Hi, Michael.
Hi.
Look who I found.
Dad.
He was down the street about 6 blocks.
Thank you so much.
You're
I'm
welcome.
sorry. Thanks. Hey, Dad.
Hello, Michael.
Yeah. I got something for you.
A present?
Yeah, sort of. It's an ID bracelet, and it's gonna keep you safe. It's got your name on it, and a phone number that somebody can call. So if something ever happens to you, they will be able to contact me and let me know where you're at, or they can bring you home. And I think it's gonna be a good thing for you.
The local Alzheimer's Association has a program called Safe Return, in which bracelets or other jewelry can be labeled with the patient's name, address, and phone number. Clothes can also be labeled. If possible, let them go outside a bit, but be safe. In most large cities, walking around late at night is not wise. However, during the daytime should be fine. When you find them anxious or agitated, remain calm. Touch the person gently for reassurance and try to keep smiling.
Dad?
What?
Are you all right? What are you doing?
I'm doing something.
Well, why don't you come over here and sit down, and let's play some music. What do you think about that?
Oh, music.
Listen to some music here. Let me find something here.
The affected person will often mimic you. If you are angry and combative, this will likely make the situation worse. If there is a person or some music that has a particularly calming effect, call that person or play that music. As many people as possible should know the person is affected to better help care for them. Too often, people want to hide the illness.
There are several medications that one may try, but I'd like to emphasize several points here. 1, only use medicines when nothing else works. 2, only use medications when it's absolutely necessary. Sometimes the affected person may stop wandering on his or her own, and the medicines won't be necessary. The third point is to consult a physician before using any medication. Using the wrong medication, or even the wrong amount of a regular medication, may be dangerous, even life-threatening.
Dad, it's time to take your pill.
For short-term problems, Haldol, Ativan, Benadryl, or Trazodone may be helpful. If the problem is long-term, Aricept or Exelon may work. Depakote, Zyprexa, and Risperdal can be tried too.
Dad, where are you going? I'm going home. Dad, you are home.
How can one prevent wandering? First, find out what does home mean to the patient. It could be their childhood home, grandmother's place, or even the bedroom they now use. Be sure to place items around the house that have belonged to them. This will help remind them that they are at the right place. Show them that they are at home at times when they are calm. Label rooms, furniture, and other items. When traveling, take some of these familiar objects with
These are
you.
the plants that you love and take care of every day. And see, here's a picture of your daughter and your grandchildren. And look, here's your granddaughter. She came to visit you yesterday. This is where you live. This is Leela's room.
Get proper exercise during the day. Don't allow sleeping during the day. You want to make sure they are tired by bedtime.
Dad, wake up. Dad. It's the middle of the afternoon. We need to go for your walk now.
Oh, I want
Now come on, we need to get you some exercise today. Come on, it's no time to be sleeping.
take a walk.
Take a walk. Let's go. Come on, get up.
Okay.
No coffee, tea, or stimulating medicines after 6 p.m. Ask your doctor which medications might be stimulating and if there is a substitute. If wandering becomes a problem, you may need to put additional locks on doors. These locks can be deadbolts that require a key to exit the house. You can find them at most any hardware store.
You can manage wandering at home. Ask the safety questions given here. Do the preventative things that you just saw, and be calm.
Are we going to the mall to look for a new suit?
Yes, ma'am. I saw this suit at the store the other day.